wanted to ask about women and cardiovascular disease, because so often it's thought of as a male problem, but equal numbers are affected, aren't they? And I know that it's at menopause really that the changes start to happen for
women. Do not generally present with chest pain or typical symptoms. One of the most common symptoms that women will have is sleeplessness for a few nights and kind of an odd feeling in their chest. You tell that to an ER doc, they're like, take some Tums. Here's a Tylenol PM, go home. And I had a lady early on in my training. They called me down. It was one of my first times that I went and did ER as a cardiologist. And she looked at me and she was polished and sharp. She was in real estate, 50 and fit. And she goes, something's wrong with my heart. EKG normal, everything like that. I ran enzymes. She was having a massive heart attack. And she was sitting just like you are looking at me, but she knew. Women need to pay attention to their instincts, and they need to demand, if they go to the hospital for it, I want a blood test to make sure I'm not having a heart attack. The EKGs are no good. They are non-diagnostic, especially for women. Menopause is interesting. Women go from 1 in 7 risk, and then they catch up with the fellows about 1 in 3 risk, right around menopause. But what day, right? I mean, it's a process. Now, hysterectomies, because you go through menopause in 4 hours. What basically happens is sex hormones like estrogen, testosterone, cruising along, neurotransmitters, serotonin, norepinephrine, things that help us wake up, things that guide our thinking, all of that stuff. Through our lifetimes, women can get stressed and those neurotransmitters drop, but the sex hormones, they help them up. They kind of cover for them. Sex hormones drop off. If you have low serotonin, low norepinephrine and things, that's when the symptoms arrive. The moodiness, depression, sleeplessness, hot flashes. It is not estrogen that causes, the lack of estrogen that causes hot flashes. It is lack of serotonin. Estrogen tells the body to release serotonin. So you do need both. There's places for bioidentical estrogens. But you have to fix that nervous system. And what causes the neurotransmitters to go down? Chronic inflammation. But it's different, where guys are going to have symptoms earlier and they can dress them. It's not until those hormones fall off that table. We've also learned something else. We did a study with Cleveland Heart Lab, and we looked at endothelial function. This is the lining of the blood vessels that tears and causes heart attacks. We know the serotonin-estrogen relationship protects the endothelium. So when a woman is going into hot flashes or mood swings, all of that stuff, the things that need to be validated, not ignored, not drugged away, but validated, we need to understand that she's also telling us that she's in the 1 in 3 risk now. She's not in the 1 in 7.